This presentation is to provide information on the normal physical gastrointestinal changes in the older adult. I will go over the changes based on each GI organ, and I will talk mainly about the normal changes of aging, but I will also mention some common diseases that can arise from these changes. Most of us know that as we age, our body secretions slow, intestinal motility slows, and the GI system tends to dry up. This can happen for several reasons. The cells age just like we do, and some of them stop working or don't work as well. The cells that produce saliva and mucus are not immune to this aging, and therefore can stop working. The smooth muscle are also affected by aging, which can cause the GI motility to slow. The smooth muscle cells must contract in a pattern and communicate with each other to move food through the GI system. As these cells age, they are not able to communicate as well or contract in a smooth pattern, and this causes a slowed GI motility. So keeping these changes in mind, let's go over how aging affects each part of the GI system. Let's start with the mouth. As we age, our teeth lose enamel, which can cause the teeth to decay and cause caries. Caries are not considered a normal part of aging, but they are common. The gums can recede, causing the older adult to be more susceptible to infection like gingivitis. The older adult can also lose taste buds and develop dry mouth, which can lead to the older adult not having an appetite. Anorexia is not normal, but can be common in the elderly. The receding gums and dry mouth are due to the mouth drying up, which happens as we age. This can be agitating for the older adult, especially if he or she wears dentures. The nurse should assess for dry mouth and gums and keep the membranes wet with a water-soaked sponge. If appropriate, the older adult can also suck on hard candy to promote salivation. A denture assessment should be included in a GI assessment for an older patient. The nurse should check for how well the dentures fit. Ill-fitting dentures can rub against the patient's mouth and cause pain. The nurse should also check for a dry mouth because this can cause irritation in the mouth when dentures are worn. The patient is already at risk for gingivitis, so the nurse should also make sure that the patient doesn't have any open sores in the mouth. These could become infected and cause even more problems for the patient. You should also check for how the patient cares for and stores the dentures. Make sure he cleans them before using them, and be sure he keeps them stored in a closed container with water. This keeps them clean and helps them not to dry out. Finally, the nurse should make sure the patient is still doing mouth care, meaning brushing his gums and tongue. This prevents infection in the mouth. Next, let's look at the esophagus. Aging leads to less coordinated, smooth muscle contractions. This can make it difficult for the older adult to move food down the esophagus and into the stomach, and the older adult may have trouble swallowing. This delay in food movement can lead to a dilation of the lower esophagus, which can be painful in the older adult. These normal changes can lead to gastroesophageal reflux disease. GERD is not normal, but is seen often in the older population. The main problem to watch for in older patients is trouble swallowing. He or she may aspirate on food or pills. The nurse should always ask about problems with swallowing before administering medication, and always make sure the patient swallowed the pills or food completely. This video shows two different swallow studies. The first one shows a normal swallow, and the second one shows what is called a silent aspiration. Watch how smooth the muscles work together in the first study to move the liquid down, then compare how that looks to the second study. In the second one, the muscles contract at different times, causing some of the fluid to remain in the throat and spill into the trachea. And now onto the stomach. We see a decrease in gastric motility, which causes the food to sit in the stomach longer. This causes the older adult to feel full longer and also reduces their appetite. We see lower levels of bicarbonate and gastric mucus. While this reduction commonly leads to peptic ulcers, these ulcers are not considered a normal part of aging. The older adult can have delayed gastric emptying and lower levels of hydrochloric acid. This acid is needed to ingest B12, so without it, the older adult can develop pernicious anemia. While peptic ulcers are not normal, they are common. The patient may not know he or she has one until they either have stomach pain or bloody emesis or stools. This can be very painful and very scary for the patient. The nurse must be quick to assess for a peptic ulcer and provide the patient education on what it is and how to avoid ulcers in the future. This photo gives a better illustration on what causes peptic ulcers. In a younger adult, the stomach has the mucosal layer with mucus and bicarbonate to protect the stomach lining from the acidity in the stomach. As a person ages, the lining becomes thinner and the acid can erode its way to the epithelial cells and gastric arteries. Once these come into contact with the acid, an ulcer develops. Next, we'll look at changes in the intestines. As the case with the esophagus and stomach, the intestines have slowed motility or peristalsis. It is important to note, however, that slowed peristalsis does not mean constipation, while slowed peristalsis can also lead to constipation. This constipation is not considered a normal part of aging. The older adult will also have shorter, less functional villi in the small intestine. The older adult can have less vascular perfusion, which can cause less absorption of important nutrients such as vitamins and minerals. The nurse must be sure to assess for constipation in the older adult patients. Since the body dries up and slows, the older adult is more prone to constipation. This assessment includes the last bowel movement, consistency of the bowel movement, how often the patient usually has a bowel movement, and any stomach pain or fullness that could be caused by constipation. This photo illustrates the changes in intestinal villi. On the left, you see normal villi, tall and skinny. These increase the surface area of the small intestine, which can increase the chance of nutrients being absorbed. On the right, you see the aged villi. These are flatter, shorter, and wider, which decreases the surface area of the small intestine and therefore decreases absorption. The one GI organ that does not seem to be affected by age is the liver. Despite the body aging and slowing around it, the liver continues to function normally. Liver function tests should remain relatively unchanged with age. If there is something wrong with the liver in an older adult, it is most likely due to exposure to toxins or damage not related to age. And finally, we reach the gallbladder. The gallbladder, like the liver, shouldn't see much change with age. The main difference is an increase in gallstones caused by decreased bile salt production. However, it is important to note that gallstones, or cholelithiasis, is not considered a normal part of aging. To sum up the information for your older patient, the nurse should educate the patient on these 4 things: pain in the mouth, trouble swallowing, stomach pain or bloody emesis or stool, and constipation. If the older adult has any of these problems, he or she should see a physician. While many of these changes seem quite unpleasant and painful, The diseases they cause should not be brushed aside as normal consequences. The older adult experiences many GI changes, but he or she should still be able to have a normally functioning GI system.